Good day, my name is Student Nurse Pusey, and today I will be performing the technique of medication administration. I will be administrating oral medication to my patient. Before any procedure can be done, a nurse should always perform proper hand washing technique. I have done a demonstration of the proper hand washing technique, so I'm going to go and wash my hand, and then afterwards I'm going to start preparing the medication for my patient. So today I will be preparing the medication for my patient. Um, first step of preparing medication for my patient, I would need my 3 documents. I have them here. So I have my 3 documents here. I have my drug chart, I have my treatment chart, and I have my patient's docket. Alright, so the first thing that I would do is I would go ahead and line my tray that has been properly sanitized with alcohol swab prior to this video. Alright, so I'll line my tray. Alright, so I've lined my tray with a napkin. Alright, so today I would go ahead and I'm just going to put my tongue depressor. This is for assessment of my patient before I administer my medication. Alright, so I'm just going to go ahead and check my documents. I'm going to check my drug chart to see which medication I'm supposed to give my patient and all the information that is needed before I give the medication. Alright, so in my drug chart or my medication administration record, I'm seeing that my patient today is John Doe. He is supposed to get loratadine 10 milligrams, which is in 1 tablet, and he's also to get acetaminophen 500 milligram, which is also in 1 tablet. Alright, so I'm gonna also check my medication. So these are the patient's medication. I'm gonna see if I have these medication on hand. Alright, so once I have the medication, I'm checking for integrity, not seeing any wetness or anything. Checking for expiration. So the medications, they're not expired. So I have the acetaminophen and the loratadine tablets. Alright, so these are both the medications. So before I go ahead and put the medications into the medication cups that I have here, I would go ahead and label each of my medication cup. And what I want to do is when I label the medication cup, I'm just going to put the name of each medication and the dosage amount that the patient is getting. So I have my nurse's tape here. Just going to cut a piece of the tape. Gonna put it on the cup. Gonna use my pen and I'll just write the loratadine. So my pen is not working. So I use my marker here, and I'll just write, okay, loratadine. And I can always check my drug chart and see how much milligram the patient is supposed to get, which is 1 tablet, which is 10 milligram. So I have loratadine 10 milligram here. Alright, then my second container I'm just going to label because I'm going to be giving two oral medication to the patient. John Doe. Alright, so the second medication is acetaminophen. And the patient is supposed to get 500 milligram. And I have acetaminophen and the 500 milligram. So I have both my containers here. Alright, so the second process is I'm gonna, on the box or on the container of the medication, it says acetaminophen, but sometimes you have to check the sachet that comes in the medication pack to see if it's the same thing. It does say acetaminophen, and it says 1 tablet is 500 milligram is what the patient should get. This is why you label a container first, so you can know what you're putting into the container. So you ensure that you don't touch the tablet and you try to push it down into the container. Alright, and you can discard of this. Alright, so my second medication is my loratadine. Alright, and the patient is supposed to get 10 milligrams, which is equivalent to 1 tablet, and it also says loratadine, and ensure that I don't touch the tablet, and I just expel it into the container. I'll discard of this. So I check the drug chart and I have the medication that the patient should get. I can do my second check by checking the treatment chart to see that this is the same thing. In the treatment chart, it does say loratadine 10 milligram, which is 1 tablet to give into patient John Doe once daily, and it says acetaminophen 1 tablet to be given to patient John Doe 1 time, once daily. And it does have the route, and it's both by mouth, PO. And then I have my my patient docket, and it has the same information, acetaminophen 500 milligram to be given once daily by mouth, and it says loratadine 10 milligram to give once daily by mouth. So I did my 3 checks. Alright, did my 3 checks. I have my medication containers, and I have my water to give to the patient, and I will take my 3 documents so I can do my checks, and I'm going to take all these to my patient's bedside to give them medication. Good morning, Mr. John Doe. Can you hear me, sir? How are you doing today? You're coming on? That's great. Great to hear. My name is Student Nurse Susie, and today I have your medication here to give to you. Now, I just want to know if you have, or are you aware of any allergies that you may have to any medication? You don't? Okay, wonderful. I'm just going to go ahead and check your armband to verify that I have the correct patient. I'm just going to ask you if you can give me your arm, please. Alright, so your armband does say that you're John Doe. Alright, and I have your correct docket here, as well as your drug chart and your treatment chart that says that you're John Doe, and your medication does say that you're John Doe. And of course, I would ask a nurse to verify also if you're John Doe. The next process. Alright, so I just want to ask you today, sir, if you can sit up in the bed for me, please. So I'm going to give you your medication. I'm going to ask you if you can sit up. Alright, have you had anything to eat?
Yeah.
Alright, so you've had your food to eat. We did want to have on my shirt. Alright, so you've had your breakfast to eat, right?
Yes, I did.
Okay. Alright, so the medication that I have for you today, I'm just going to tell you about your medication. Alright, so the first medication that I have for you today, I have your acetaminophen, and this is your acetaminophen. Now it's supposed to be taken by mouth, and it's used for the pain that you're experiencing, so the mild pain that you are experiencing. Side effects may include insomnia, which is the inability for you to sleep or difficulty sleeping, fatigue, which is tiredness, and you may feel nauseous, like you want to vomit. So those are the side effects. The benefit is that it does help with the pain that you are experiencing, so you won't feel the level of discomfort that you're having recently, right? And it's prescribed by Dr. Kendall. It was prescribed by Dr. Kendall. The adverse effect, or the most severe effects, which are normally rare and doesn't really happen that much, sometimes include muscle spasm. So you'd have like muscle problem, but that's something that might not happen, right? Alright, so is it the second medication that you will be getting today is loratadine. And loratadine, the benefits is that it is used for your the allergic reaction that you are experiencing to the environment that you're working in. So the allergic reaction that you're experiencing, that is what the loratadine is used for. It's also used for the itching that you're experiencing and the swollen eye that you get at times, right? The side effects may include drowsiness and dizziness. Are you understanding?
Yeah.
Okay. So the side effects are drowsiness and dizziness, and it also may include fast heartbeat. And when you're taking loratadine, it's advised that you avoid any alcohol. So if we don't provide alcohol at the hospital, but if family members are taking anything to you, ensure that it doesn't have any alcohol content, okay?
Yeah.
All right. So there is no known adverse effect to loratadine, but it is beneficial, and the side effects are normally rare to minimal. Alright, so you'll be getting 10 milligram of loratadine, and you're going to be getting 500 milligram of acetaminophen, and these are both available in one tablet each. Okay, so before I provide you with your medication, I just want to get your consent. Is it okay if I provide you with the medication?
Yes.
Okay. And before I do give you the medication, I'm just going to give you this tongue depressor. And this tongue depressor, basically, it's for me to test your gag reflex to see if you're able to swallow. So I'm going to ask you to take the tongue depressor out of the napkin for me, please. And you can, once you take the tongue depressor, I'm going to ask you to open your mouth widely and extend it to the back of your throat, like you're brushing your teeth, to see if you're able to gag. Okay, you can stop now. You can put it back into the napkin. Alright, thank you very much. So I'm just going to give you your acetaminophen. But would you like the water first or the medication? So you can take the water. Alright, can you open wide for me, please? Can you lift up your tongue? Alright, so I'm just checking to see if you have swallowed the medication. The second medication is your loratadine. Alright, and here's the water. Alright, I'm going to ask you to open again for me, please. And lift up your tongue. Alright, so the patient has swallowed, you have swallowed the medication. Now I'm just going to advise you that these medication, if you're feeling any effects of the medication that I have notified you before, or if you're feeling any way that you might not see as normal, I'm going to ask you to notify either me or any nurse that you may see on the ward, okay? Alright, I'm going to go ahead and check back with you in the next 15 to 30 minutes to see if there's any complication or to see the effects that the drug may be having on you, okay? Alright, is there anything that you'd like me to do before I go? You'd like more water? Okay. Alright, thank you. Alright, so this would be the end of how you administrate oral medication. So I would now go ahead and discard of all the items that I used during the medication procedure. I would go ahead and clean up all the items that I need to clean, and then I will go ahead and wash my hands and document to say what I gave to the patient, how much milligram I gave to the patient, what route I gave the patient the drug by, and how the patient tolerated, as well as the education that I provided to the patient about each medication, the use, the side effect, and document the patient compliance to accepting the medication.